Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Welcome to another edition of Ask the Chiropractor. Today I'm going to talk about something that a lot of chiropractors get guilty of assuming that patients already know, or maybe other healthcare providers already know. But we continuously get surprised again and again by the lack of people who don't seek our care for this condition. What is that condition? Disc problems, lower back disc problems in particular. A lot of people today still don't know they should go to a chiropractor when they're having a lower back disc issue, lumbar disc issues. Chiropractors have been taking care of this forever and ever. And just recently, another study came out proving this again. The Frontiers of Medicine 2025, January 3rd edition. Comparative clinical efficiency of acupuncture combined with manipulation or other non-pharmacological interventions in treatment of a lumbar disc herniation. A prospective, multi-arm, randomized, open-label, blinded endpoint trial. So what did they do? They went through all the research again and they looked to see, other than pharmacology, what's the best way to take care of a lower back issue. And again, they found that chiropractic leads the way. Much better than traction, much better than physical therapy. Now, chiropractic with traction, chiropractic with therapy, chiropractic with acupuncture, these are all things that are awesome. You even increase your odds of improving. But again, over and over again, you can go to PubMed and find articles. What is PubMed? I've talked about this many times. PubMed is the place where research gets publicized that's universally accepted, meaning that any one journal can print any one thing. But to get your journal, your research paper, PubMed indexed, means it goes through a tremendous amount of scrutiny to make sure that your research is valid, was done properly, and is something that you can look at. Myself, I don't always see eye to eye with different medical providers, so whenever I walk in, I usually walk in with 3 or 4 PubMed articles, and we just don't argue, because we're not going to argue with the results of PubMed. So if you were to go into PubMed and type in chiropractic and disc herniations, you just won't believe the amount of studies you find. Now they call this a manipulation. That's the term in research they use for a chiropractic adjustment. But they show that chiropractors are doing the best when it comes to disc herniation. What is a disc herniation? What's going on? Between each one of your bones you have a disc. Your lumbar spine, your cervical spine, and your thoracic spine. The bones of your vertebrae that makes up your entire spinal column. There's a disc in between. The disc has a gelatin, watery-like material in between them. It acts as a shock absorber. It also allows you to move and bend. If I turn my head to the left, the disc move and rotate with the vertebrae, allowing me to go. They actually sadly bulge as I do it. They're designed to bulge. If I lean to the left, all the vertebrae and the disc in my neck, all those discs just bulge a little bit. They're designed to bulge. Someone tells you you have a disc bulge, that's not a weird thing. The discs are designed to bulge left and right. They move and shift so the vertebrae don't have to. They help increase the loads. In the morning, you're taller than you are when you go to bed, because during the day, those discs take a lot of the gravity forces and they actually shrink a little bit. You lay down, you go to sleep, and those discs regenerate and they get bigger again. You can always tell the health of someone's spine. Not be the whole spine, but the individual spine vertebrae based on the disc in between them. What happens is your discs have no direct blood supply going to them. If 1 or 2 of your bones are subluxated, meaning that they're in stress, they're out of alignment, they're not moving the way they're supposed to, the body intelligently locks them up so they can't damage themselves anymore, but now there's no motion between those 2 bones. What happens then is the blood supply there is no blood supply. What happens is when you move and twist and bend, the muscles contract and they push nutrients in and out of the joint spaces. If the vertebrae are locked up because they're subluxated, then there's no flushing or adding nutrients to the disc space. The result of this, the disc starts to dehydrate and flatten. As you lose your disc height, there's a scary term they use for this. It's called degenerative disc disease. What it really means is your disc is slightly dehydrated. What a chiropractor does is they'll detect these subluxations and they'll restore the motion and make them move again. Once they start moving again, they start healing again. How do we do that? We use x-rays mostly. We'll pick an x-ray of your spine, we'll see the area that's not moving. Then usually we'll use our fingers to go up and down your spine and feel them move individually upon each other. Lastly, we might do leg checks and other checks like shoulder checks and stuff like that to see how you line up and what happens when you move and twist. An example, if the base of your neck is off, at your 5th or 6th cervical and your neck is misaligned, when you turn your head, they will not move. Instead, your whole spine will move. So if you're laying in a face down position and you turn your head to the left and there's a subluxation at your C5 and C6, they will not move. So your whole back will move and your feet length will dramatically change because your whole spine's moving to compensate for that subluxation. That's what we call a cervical syndrome. That's one of the tests your chiropractor does that's unique to chiropractic. It's a chiropractic exam. So with all this research going on and all this evidence that chiropractors can go in there and make these adjustments, allow the vertebrae to move again, allow the nutrients to get back into the disc space. And if the disc is herniated, why is it herniated? Well, it's herniated because the vertebrae are misaligned, putting an unfair stress on it, causing it to bulge out and stay bulge out. But if we can go in there and restore the motion and make them move again, then what happens is the disc will reabsorb itself and go back to normal and the spine starts to heal. Now, how do we know this happens when a chiropractor does it? We've got tons and tons of research and science that shows that it happens. There's no I believe in chiropractic can help my disc bulge. You don't have to believe in it. We have the research and the science. It's abundant. It's in all the literature. It's everywhere. Matter of fact, the WHO now recommends chiropractic care first for disc problems and issues in your spine, even before medicine or any type of intervention. The North America Spine Center recommends chiropractic above anything else. Number one choice if you have a back problem, the North America Spine Society. Who is this made up of? Well, it's made up of orthopedic doctors, surgeons, medical doctors, and other therapists, not chiropractors. But they're saying chiropractic's the best. So why aren't you hearing more of this? I have no idea. Old stereotypes, lies that have been said about my profession for decades and decades and decades. Who knows? Fear, not understanding, old professors teaching stuff wrong, take your pick. But if you want to look at the science and the research, and you want to look at what's published, and you want to look at the recommendations of the WHO, the North American Spinal Society, over and over and over again, it says chiropractic. So if you're having a disc problem in your lower back and you're hesitant to see a chiropractor, my question is why? Why would you be hesitant? We have all the science in the world to prove it works. Chiropractic has next to no side effects, no negative side effects. Lots of positive ones, right? Because we help the nerves where they go and everything they do, not just the back pain. Tons of positive ones. This is because you might have to go again and again. You're going to have to do that with physical therapy. You're going to have to do that with going to the gym. So that's an unwarranted fear. When you go to the chiropractor for your lower back pain, the chiropractor, one, should be able to use x-rays you've already had as long as they're recent. If not, it takes some new ones, do the exam on you, tell you what's wrong with you, show you on the x-ray or the findings what they discovered, then review a care plan with you with obvious goals. Introduce more stuff along the way that you can help you heal. Like the number one way you help a lower back heal is getting up and walking. Moving. I think it's comical. That's in a 1926 chiropractic textbook, to get up and start moving after you get adjusted. And over the last 10 years now, when you have an orthopedic surgery, now they tell you should get up and move around. That's been in our textbook since 1926. So to me, it's comical that we're a new thing. We're an alternative thing. We've been around for a long time. We haven't changed very much what we do, just because it works. We might change the way we detect it and find it, but chiropractic's been around forever. So again, if you're not going to the chiropractor, we have these weird reasons. Either when somebody's scared you not to go to the chiropractor, there's no reason to be scared to go to a chiropractor. That's crazy talk. We have the lowest malpractice rates of any healthcare provider because we don't hurt people. People don't come here as a typically and get injured. The likelihood of getting injured at a chiropractic clinic, you're the least likely to get injured at a chiropractic clinic than you are any other type of healthcare provider. We're the safest healthcare provider. Now, is everything perfect? No one's ever perfect. But how many surgeries have you heard that go bad? You hear about them all the time. Or infections that happen, stuff like that. They happen all the time. But with chiropractic care, it's very infrequent that somebody ever gets hurt. So we are safe. Next thing, why don't you go to a chiropractor? Maybe a doctor told you not to go see us. Well, don't listen to them. Don't trust them. They're not chiropractors. They don't know. They never studied chiropractic. Only chiropractors study chiropractic. So the only person you should trust if you should go see a chiropractor is a chiropractor. So get your information from your doctor, get your x-rays, go ask a chiropractor whether they can help you or not. They're the only ones that know. So if you've had a disc bulge, disc problem, lower back issue, I'll put a link to this next research paper like I always do. But there's just tons and tons of research papers out there about the benefits of chiropractic care for lower back issues and disc issues. There's just, every time I go on the internet, I find more. Oh, the colleges are putting out new papers all the time. It's gotten to the point, like, can we please research something else? Because we've researched this to death. But it doesn't really matter because the majority of people still aren't seeking chiropractic care first. So I guess we have to continue. That's why I decided to do this podcast today, to share with you that chiropractic should be your number one choice when you have disc issues in your spine. Number one, but even more number one, especially in your lower back. All right, if you have questions about chiropractic or chiropractic care, the only person that you should listen to or talk to is a chiropractor. They're the only ones that know. Never ask your chiropractor questions about your teeth. Never ask podiatrists questions about your hair. Go to the experts. Go to the doctors that do those things. Thank you for tuning in. If you have a question about chiropractic or chiropractic care, leave a message or a comment wherever you're listening to this or hearing this, and I will make sure maybe next time you'll be the question of the week.